Plants have been central to medicinal practices for thousands of years, but modern science has elevated many traditional remedies into life-saving pharmaceuticals. Thanks to advancements in chemistry and pharmacology, several drugs originally derived from plants have become essential in treating a range of conditions, from cancer to heart disease. Here, we explore 9 notable modern drugs that are derived from plants and their impact on medicine. Number 1. Taxol, paclitaxel. Taxol, or paclitaxel, is derived from the bark of the Pacific yew tree. It is a prominent chemotherapeutic agent used primarily in the treatment of ovarian, breast, and lung cancers. The drug works by interfering with the normal function of microtubules during cell division, effectively halting the proliferation of cancer cells. Discovered in the 1960s and approved by the FDA in 1992, Taxol revolutionized cancer treatment and significantly improved survival rates for many patients. Paclitaxel stabilizes microtubules, preventing their depolymerization, which is crucial for cell division. By doing so, it arrests cells in mitosis, leading to cell death. Taxol has enabled more targeted and effective chemotherapy regimens, particularly when combined with other drugs. Its success has spurred research into other plant-derived compounds with similar properties. Number 2. Quinine. Quinine, extracted from the bark of the cinchona tree, has been used for centuries as a remedy for malaria. It was one of the first effective treatments for the disease, which has caused significant mortality in tropical regions. Quinine works by interfering with the growth and replication of Plasmodium parasites within red blood cells. Quinine inhibits the parasite's ability to digest hemoglobin, leading to their death. It also suppresses the parasite's ability to reproduce. Quinine's discovery marked a turning point in the fight against malaria. It laid the groundwork for the development of synthetic anti-malarial drugs and remains a critical treatment in areas where other medications are less effective. Number 3. Morphine. Morphine, derived from the opium poppy, is a powerful opioid analgesic used to manage severe pain, particularly in cancer patients and those recovering from surgery. Morphine's effectiveness in pain relief has made it a cornerstone of palliative care and emergency medicine. Morphine binds to opioid receptors in the brain and spinal cord, altering the perception of pain and producing a sense of well-being. Despite its potential for addiction, morphine remains one of the most effective painkillers available. Its use has been critical in managing pain and improving the quality of life for many patients with severe and chronic conditions. Number 4. Vincristine and Vinblastine. Vincristine and Vinblastine are alkaloids derived from the periwinkle plant. These drugs are essential in treating various cancers, including leukemia, lymphoma, and testicular cancer. They have contributed to significant advances in cancer therapy and are integral to many chemotherapeutic regimens. Both vincristine and vinblastine disrupt microtubule formation during cell division, which prevents cancer cells from completing mitosis and leads to cell death. These drugs have greatly improved cancer survival rates and are used in combination with other chemotherapeutic agents to enhance effectiveness. Number 5. Aspirin. Aspirin, or acetylsalicylic acid, was originally derived from salicin found in willow tree bark. It is widely used to relieve pain, reduce inflammation, and prevent blood clots, making it a critical medication for heart disease prevention and management. Aspirin works by inhibiting cyclooxygenase (COX) enzymes, which are involved in the production of prostaglandins that mediate pain and inflammation. Inhibition of COX also reduces platelet aggregation, helping prevent heart attacks and strokes. Aspirin's broad range of applications has made it one of the most widely used medications globally. Its role in cardiovascular health has saved countless lives and has been pivotal in preventive medicine. Number 6. Digoxin. Digoxin, derived from the foxglove plant, is used to treat various heart conditions, including atrial fibrillation and heart failure. It helps improve the efficiency of the heart and regulate its rhythm. Digoxin increases the force of heart contractions and decreases heart rate by inhibiting the Na+, K plus ATPase enzyme, which leads to an increase in intracellular calcium levels. Digoxin has been a key medication in managing chronic heart conditions, improving the quality of life for patients with heart failure and arrhythmias. Number 7. Atropine. Atropine is derived from the belladonna plant and is used in a variety of medical situations, including as a pre-anesthetic agent to reduce salivation, in ophthalmology to dilate pupils, and as an antidote for nerve agent poisoning. Atropine works as an anticholinergic agent by blocking the action of acetylcholine on muscarinic receptors, which affects various physiological processes. Its versatility makes atropine a valuable drug in emergency medicine, surgery, and eye care, contributing to better management of several acute and chronic conditions. Number 8. Colchicine. Colchicine, derived from the autumn crocus, is used primarily to treat gout and familial Mediterranean fever, FMF. It is known for its ability to reduce inflammation and alleviate pain associated with these conditions. Colchicine disrupts microtubule formation, which decreases the migration of inflammatory cells to affected areas and inhibits the release of inflammatory mediators. Colchicine's ability to control acute gout attacks and manage FMF has provided significant relief for patients with these painful conditions, enhancing their quality of life. The drug Reserpine is derived from the root of the rauwolfia plant, Rauwolfia serpentina. Traditionally used in Ayurvedic medicine, Reserpine was introduced into Western medicine in the mid-20th century as an antihypertensive agent. This antibiotic's efficacy in targeting bacterial cell walls paved the way for the development of various penicillin derivatives, such as amoxicillin and methicillin, which broadened its therapeutic applications and improved its resistance to bacterial enzymes. The plant kingdom has provided a rich source of therapeutic agents that have transformed modern medicine. From cancer treatments like Taxol and Vincristine to pain management with morphine and aspirin, plant-derived drugs continue to play a crucial role in healthcare.